As of yesterday, 70% of COVID-19 vaccines in Saskatchewan had not been administered. The province says that is changing. Part of the reason were some of the doses had to be held back, while others were headed for their intended targets in northern Saskatchewan. The health minister says that targeted healthcare workers in Regina and Saskatoon have now received their first dose, with their second dose coming imminently.
It looked like we had less yesterday, but we're actually at over 100% here in Regina, and 100% of the vaccines have also been the first dose in Saskatoon. So we're getting them out as fast as we can.
Merriman says the province's current allotment from the federal government is not enough. The province's chief medical health officer says more vaccine will come in the spring, but as of now, it's arriving in fixed intervals and in smaller numbers. Dr. Shahab says getting the vaccines, which need to be kept extremely cold and then administered days after thawing, is complex, and delivery to remote parts of the province can be challenging. For now, Shahab says lowering community transmission is crucial to saving the lives of those first in line for a vaccine.
It is a race against time, January and February, to get all long-term care residents, staff vaccinated. I think that is a challenge that has to be met. It's complex, but we all have to do our part to make that happen.
Shahab says the health system has the ability to scale up and deliver more flu vaccines when they become available. He says every year they deliver 80,000 flu vaccine doses on a weekly basis, but don't expect that kind of mobilization until mid-year.
We have to practice all these public health measures that we're practicing all the way at least till May, June, until the vaccination really picks up to address the broader population, and then hopefully by September we can come out of the pandemic.
Shahab says the timeline could change depending on the availability of vaccines, a supply the government is hoping will increase as soon as possible. Adam Hunter, CBC News, Regina.